Hi, I'm Dr. Rocco Piazza, board-certified plastic surgeon at the Piazza Center in Austin, Texas. We are thrilled that you've joined us today for our discussion about Profound. I think you're going to find exactly why we believe in this technology and why we brought it into our practice for you. This is an exceptional treatment with minimal downtime that allows for some of the best tightening of skin of the face region, body region, and cellulite treatment in the marketplace. We spent several years researching this technology and know that this is the right fit for us and for you. So I'd like you to stick around today and watch this entire talk. I think you're going to like what you see, and I'm available for you live at the end of this presentation so that I can get your feedback and answer any questions that you may have. We spent over a year researching radiofrequency technologies to tighten the skin of the face, neck, body, as well as treat cellulite in the gluteal region or thigh region. And what we discovered is that there's no other technology in the marketplace quite like Profound. The clinical studies support this device in all of these treatment areas and is something that we felt brought the best treatment to our patients for these needs. We know that this technology works. We've seen it, we've been using it for quite some time, and now we're really ready to share it with you.
Hi, I'm Allison Kothman. I'm a registered nurse here at the Piazza Center for Plastic Surgery and Advanced Skin Care. Profound is an FDA-cleared radiofrequency injection system that can produce 5 times the elastin in one setting. So you might be wondering, what exactly is elastin and why do we need it? So elastin is one of the building blocks in our skin that gives us the snapback. As we age, we lose elastin along with collagen and hyaluronic acid. So Profound is different from other types of devices because of its unique ability to combine microneedling with long pulse radiofrequency. The combination of these two treatments synergistically together gives you significant skin remodeling. So Profound can be used on the face, specifically for the jowling area, the lower jaw, and also the neck, And then on other areas of the body, we can do the abs. It can also be used on what people commonly refer to as bat wings, or the arms, the muffin top, the upper thighs, or the lower thighs above the knees, where we get skin laxity with aging. So you might be wondering, who is a good candidate for Profound? Actually, anyone who is looking to improve their texture, firmness, or tightness to their skin is a great candidate for Profound. Profound can be used on every skin type, and it can also be used to treat cellulite. So to prepare for your Profound treatment, there are some pre-treatment guidelines that we have set for you, and then also some post-care treatment. For your pre-care, we like everyone to start on Alastin Nectar for approximately 2 weeks before your treatment. This will help your body heal quicker, and you'll start seeing results sooner. We also recommend starting on Arnica Montana tablets before your treatment. This will help mitigate any bruising or swelling you may have post-treatment. Post-treatment, we recommend continuing on your Alastin Nectar and then also applying Alastin's Laser Soothe and Protect to help your skin heal. Following your Profound treatment, you can expect some downtime. Downtime is a little bit different for everyone, but during this downtime, you can expect the soreness, a little bit of redness, a little bit of bruising, and also swelling. This can last from approximately 2 to 10 days and can vary per person. So patients typically see results from Profound in as little as a couple of weeks after their treatment, because the collagen, elastin, and hyaluronic acid has started forming and improving the skin's texture, firmness, and tightness. You can see maximum results at around 6 months with a facial treatment, and we can see results from a cellulite treatment as early as 3 months.
Hi, my name is Carrie Trabue, and I've been coming to the Piazza Center for about the last 6 years now. I ran into Dr. Piazza at a cocktail party, and I said to him, because he's a friend and I've been coming here for a long time, that I said, I don't know what happened during COVID, but my skin is sagging everywhere. And I showed him my arms, and they waved. And he said, oh my gosh, we just got Profound, and you need to come by and try it out. And so, in fact, so then Haley reached out to me and said, would you consider being sort of our beta customer to try, you know, when the trainer comes in town, to try out Profound? And I was like, absolutely. So came in and had a profound experience. You know, it was probably like an hour-long procedure. They used lidocaine, so it was really not very uncomfortable. And they used 2 different sets of needles, where one is usually, the one needle length is for the cellulite on the arms, which a lot of us women get up here, including me. And then the other needle is for the skin elasticity issue. And so they used both on me, and literally within 2 months, I had experienced dramatic results. And in fact, the results have continued to improve, and honestly, they're quite remarkable.
Thank you very much for attending our virtual event today. We hope that you discovered how important Profound is to us here at the Piazza Center and how we think it could benefit you. I'd love to answer your questions, so please place a question in the question box on your screen. We'd also like to extend you an opportunity to come in and see us for a consultation. Be on the lookout from a text from us inviting you in for a consultation at our clinic. Just say yes. We can't wait to see you. Hi.
Hi, good evening. This was so exciting. I'm so thankful for all of our patients. We truly have the best patients and so excited to share more about Profound with you guys tonight.
We're really excited to be here. We've got some questions that have popped up, and we want to go through these one by one. I'm, of course, Dr. Rocco Piazza. This is Allison Kothman, and Allison is an advanced nurse injector and laser specialist at our clinic. I'm a board-certified plastic surgeon and started the Piazza Center about 10 years ago, 11 years ago now, really focusing on bringing in the latest and most advanced treatments for skin, face, breast, and body. And so part of that is the non-surgical arena, where we've really focused heavily on researching treatments that work well, as you heard in this talk. What we'd like to do is go through and answer some of the questions that we've had pop into our Q box here. One of those talks specifically about how Profound compares to Fraxel in terms of skin tightening. And I'm not sure the statistics on Fraxel. We have a dual laser similar to Fraxel called the Halo. And Halo does result in some skin tightening, which we see with that treatment. It's a treatment used to resurface the skin and to remove sun damage, get rid of the fine lines and wrinkles, but as well as clean up both the deep layers of the skin and the superficial layers of the skin. Profound is slightly different. Profound is using a needle device that goes into the skin when we're talking about skin tightening. And for a very specific amount of time, 3 seconds, we generate a very specific amount of heat, like you saw at the beginning of this video. And that allows for collagen and elastin to be produced, as well as hyaluronic acid. It is a very specific targeted treatment for tightening. We celebrate tightening with things like Halo and Fraxel. We really are specifically going after skin tightening when using Profound. We know that this results in a 37% improvement as compared to a facelift. So if a facelift is 100%, you have surgery, you've got downtime for weeks to months. This is a non-surgical way to get you over a third of the way towards a facelift without having surgery. And this is building collagen and elastin in the skin versus a facelift, which is just pulling the skin and repositioning the soft tissues. I hope that helps to answer your question. We have a question about specifically using products on the skin in preparation for this treatment. And I know Allison touched on in this video about elastin and how important elastin's regenerating nectar is to producing excellent results. We know pre-treatment with this product is very important when we want to clean up the skin, clean up the dermis, improve the collagen and the elastin production in the deep layers of the skin. We know that this will put you at a very different playing field when you have this treatment. So we believe in pre-treating the skin for 7 to 14 days prior to your treatment. There's a question about same-day consultation. So in treatment, we would want you to see you in consultation, do a Vizia skin analysis, and then start you on regenerative nectar in preparation for your treatment. But the question pertains specifically to retinol, and should you stop using retinol? And the answer to that is yes, you should stop using retinol prior to your treatment. And we recommend 2 to 4 weeks because it can cause irritation and significant cell turnover, and we don't want to do that in preparation for the treatment. However, you may resume this treatment several weeks later. So we really believe retinol is a very important part of your skincare regimen. And we do agree with you using it, but we would want you to stop it in the immediate pre and post treatment period. There's also another question about losing facial fat. And Allison, I'll let you specifically talk about that question.
Okay, thank you, Dr. Piazza. No, you do not need, the specific question is, do I need to be worried about losing facial fat? The answer to that is no. We use 2 different cartridges when we use Profound. One is specifically for dissolving fat or mitigating fat with a subdermal cartridge. The other one is a dermal cartridge. So on the lower face, we use the dermal cartridge, which is specifically for creating elastin, collagen, and hyaluronic acid to tighten and give firmness. We also measure the face beforehand, and we are very careful to go below the cheek so we don't lose any of that fat in the cheek pads.
It's an excellent question. There are situations where we'll want to target areas like the jowl fat or the submental fat. And in those situations, we can reposition our dermal needles, or use the second cartridge meant for subcutaneous fat treatment to specifically target the fat. We've been trained to know exactly what it feels like to target fat versus skin. That's a really important part of the treatment to make sure we're getting an effective treatment. So I hope that helps to answer that question. We have a question about what the treatment actually feels like. And Allison, I know you've had this experience already. Can you share with our participants what this actual treatment feels like?
Absolutely. And I've had the opportunity to have the dermal treatment and then also the body treatment. The dermal treatment is very comfortable. We do numb, like the video said, with a lidocaine injection beforehand. I would say the lidocaine injection is the most uncomfortable part of the procedure. We also have the availability of having a sedative to help you relax a little bit during that treatment. I just recently had the subdermal treatment to my upper thighs this week, and I have to say it was honestly super easy. I was impressed with how easy it was. We did a little bit of lidocaine injections on me. I did not need a sedative, and it was great. It took probably less than an hour and 30 minutes tops to complete. It does feel a little prickly. Like if I was to describe what it actually feels like, it just feels a little prickly. And there's also a little tingly, a little bit of a little heat to it.
We have another question that asks about restrictions on sun exposure pre and post treatment. And I think it pertains to either face or body. And it's important to understand that we are huge supporters of protected sun exposure. So, that is not an issue. What does that mean? It means wearing a swim shirt if you are having this done on your arms, right? So that your arms are covered from direct sun exposure. It means using protected sunscreen, a big hat, big glasses. We wouldn't want you going into the sun or getting a sunburn within 7 to 14 days prior to the procedure. And likewise, post-procedure, you're going to have inflammation in these areas. We're specifically causing inflammation because we're stimulating collagen and elastin production by causing a controlled amount of very predictable damage. And so when you go out into the sun and you get exposed in areas that have inflammation, you're at risk of getting post-inflammatory hyperpigmentation. So it's very important to understand that we really want you to keep those areas covered and protected when in the sun. Usually by about 4 weeks later, it's no problem if you were to have an inadvertent sun exposure. But again, just be very cognizant. Sunscreen and protected sun exposure are okay. We have a question about, does this work on the face other than the jawline? And I know, Allison, you touched base on that a minute ago with regards to your leg area. Could you expand on that for us?
Yes, and I think the specific question to me, it reads, does this work on the face other than the jawline? So the answer is yes. In fact, we've treated people around the eye area on the face. And then also as far as the lower face, we can go all the way down the neckline with it. And then yes, as far as body treatments, we can do skin tightening pretty much basically anywhere you'd want to do it, on the arms, on the abdomen, the muffin top area, the area on the frontal part of your thighs right above the knee where there's laxity with aging, saddlebag area. There's not really very many areas that are off limits.
Allison, we have a question specifically that says, will this be effective at reducing nasolabial folds? And I know that that's kind of a complex answer. I think this is all helpful in addressing the nasolabial folds, but there are other things that may be needed in order to really give full restoration to the folds. Could you expand on that?
Yeah, it's absolutely a great question. It will soften the nasolabial folds, absolutely, if that is a concern. I definitely think it would work amazing with synergistic treatments, meaning an evaluation for whether fillers would be needed, because there's a lot of things that cause nasolabial folds to happen, and it's not just the skin. We also have bone loss with aging, we have fat loss with aging. So we would want to make sure that we treat that patient as an individual and treat the causes of the nasolabial folds.
We have a question about how soon after the treatment can hyaluronic acid fillers be done. And I think this is a great question and depends largely on where that is going in the face.
Definitely. That is a great question. So I would say in the area, we want to wait at least 3 months because we want that complete collagen regenesis in the area before we place fillers. So if you're for example, do lower face like I did, you want to wait 3 months before you add any fillers in that area. If we're going above the area that we treated or below the area, I would say probably at least a month would be doable for sure.
We have a question about how long the treatment lasts and what is the cost of the treatment.
Okay. Okay, so the results start. I'll start with when they start to kick in. So you can see results as soon as 12 weeks, about 3 months after the treatment. That is on face and dermal. We see maximum results anywhere from 6 to 12 months. Because this is a treatment where we're wanting the body to respond to what we're doing, it's very variable per person, but we're going to see those optimal results anywhere from 6 months to a year. There are several people that, they are so incredibly happy with their results that it's a one and done deal for them. They love the results. We have other people that love it so much and they know what it does and they get that stimulation of elastin, collagen, and hyaluronic acid that they'd like to repeat it every year, or they choose other areas to do.
And what is the cost? Can you explain cost for this?
Absolutely. So our pricing is normally $4,500 for the face and neck area. And when I talk about the face and neck, I'm talking about the lower face and then the neck. That's considered one area. With this event, you can take $500 off that area. And then for anywhere else, I can just elaborate on that for pricing right now. Any other areas, if we're doing treating one area with the dermal, it is the $4,500 for this event. You have the $500 discount. Our cellulite treatment cost is $5,000, and you can take $500 off that area. Now, if we do a dual treatment, like the patient that was in the video, that would be $500 off the first area, and then it's $500 off the add-on.
Thank you, Allison. We have a question here that says specifically, does it help or change the appearance of stretch marks? And this is a great question. So stretch marks is when there is a tear in the deep layers of the skin and a kind of an absence or deficit of collagen and elastin in those areas. This specific device wasn't tested on stretch marks, but we do know using profractional laser, which is an erbium technology made by Cyton, we can lessen the appearance of stretch marks. It does usually require 3 to 6 treatments, and these treatments are spaced usually 6 weeks apart. So stretch marks can be made to look better or to blend in. It's a very challenging problem, and we are still on the search for the very best stretch mark eraser possible. We just haven't discovered it yet. Why is it necessary to have a ride home after the treatment? This is a question that we have here. Allison, answering that?
You would need a ride home if you took a sedative. I highly recommend, from my own experience, taking a sedative if you're doing lower face or neck. It's an option. It's definitely an option that you can have if you do a body treatment as well. So if you are under the influence of a sedative, for your own safety, we want you to have a ride home after the treatment.
We have a question about the cost of treatment for the neck and the jowls. So that would be neck. I would expect full neck as well as lower face.
Okay.
Here all the way down through here. Do you have that?
Yeah, so that would be considered a skin tightening one area, which is $4,000, and then an add-on area, which is the add-on areas are $1,500, so it would be another $500 off of that area for going all the way down the neck.
We have a question that says specifically about can fillers and Botox be used after this treatment? And the answer is yes. And I believe typically 3 months for the dermis, but mid-face fillers within a month or so. Is that correct?
Yes, definitely.
Go
ahead. Sorry.
Go ahead.
I see. Will you make this recording available for later viewing? If you signed up for this webinar, it is available for you to view again.
We have a question about the saggiest part of my face is under my eyes where my crow's feet are. Will Profound help tighten those areas? This is considered an off-label treatment area. I know we do treat the sides of the eyes with the dermal, but as far as the lower lids are concerned, that is an area that we don't treat with Profound. That is an area that we do treat with profractional laser resurfacing and contour TRL laser resurfacing. That's using Sciton's Erbium technology in order to resurface the skin and specifically target tightening of the upper and lower eyelids non-surgically.
Okay. And I'll address the next question. It says, do you have to wear tights if you do an upper leg treatment? No, you don't. I haven't worn tights this week at all, but definitely if you're someone that's prone to swelling or it just feels good to have some compression tights on, I say go for it. It'd be great.
We have a great question here about when choosing Halo and Profound, which treatment would you do first? And I think it really depends on what we're targeting. If we're looking at resurfacing the skin, cleaning up the dermis, and creating a smoother texture of the entire face and nose, then we're really talking about Halo. Halo is the best way to create dual action. It's a hybrid fractional resurfacing laser, which means that we're targeting specifically the dermis with one of the laser wavelengths, and we're targeting ablation of the skin or a polishing of the skin with the second wavelength simultaneously. This fractionated type of treatment resurfaces the skin very quickly, but also very efficiently, so that you are able to recover within 5 to 7 days. We know that when pre-treating with elastin regenerative nectar really makes a huge difference on your recovery time and allows you to be, event ready within 5 to 6 days after the treatment. I hope that helps. Profound is used primarily for laxity, looseness of the lower face, neck, and jawline. And that's when we use that treatment specifically for those areas. It is microneedling, so you will have some resurfacing effect in the skin treated, but it is not the same as Halo. It's a different technology.
Mm-hmm. And I would further comment on that when trying to choose between Halo and Profound. I would choose the treatment that corrects the issue that bothers you the most first. Come in, let us create a plan that's specifically for you. So if texture is your main issue and your skin texture is really bothering you, go with Halo first. If it's that your skin feels lax or loose and you want your skin tighter, then definitely I would say go with the Profound first.
I agree with that. That's a great answer, Allison. We have a question about lines around the mouth. How do you treat them? Does Profound work to erase or to repair the lines around the mouth?
It absolutely can. I wouldn't ever say that it would erase the lines around the mouth, but it's definitely going to, give you a boost of collagen and elastin and hyaluronic acid in that area and smooth those lines. Definitely the lines around the mouth. And Dr. Piazza can speak to this. We have some other laser treatments that, depending on, what the problem is, they might be a better suited for the Sciton resurfacing.
Yeah, we use, again, contour TRL laser to carefully resurface the rhytids or wrinkles around the lines. And that's the best way for us to really make a significant impact on that area. When we're using Profound, we are absolutely treating right up to the lid margin or the lip margin. So we're treating the entire area between the base of the nose and the red part of the lip. And that does help to make those areas better. The reason why those lines form are from years of environmental exposure, sun exposure, etc. And what happens is over time, as the muscle around the mouth causes a breakdown in the collagen and elastin in those areas. So we're absolutely impacting that. But there may be a more definitive treatment for very severe lines by using resurfacing treatment. We have a question about neck bands. Can Profound improve the vertical necklines and neck bands, also called the platysmal bands?
As far as the vertical necklines, yes. Again, it's treating the laxity more than the necklines. The necklines are more of a texture issue that we can treat with Botox and fillers, or we can treat with one of the lasers. But definitely, as far as laxity, Profound is your best bet, and vertical lines will definitely have an effect on them and smooth them out. And then the question as far as the neck bands are they're called platysmal bands. They're muscles. I've got them, and they're best treated with Dysport or Botox, non-surgically anyway.
We have a question about how pricing works again. If I wanted my neck and upper arms done, what does that look like?
So that would be considered 2 areas.
Can you recap us on that so that just
Definitely. So the first area is it's 4,500 and you get $500 off, so it'd be 4,000. A second area add-on, and this is if we can do it on the same day, would be 1,500. So in that case, I would definitely want to see the patient and be able to measure out the areas. This kind of goes into a little bit more scientific detail, but we use lidocaine to numb the areas, and we want to safely be able to treat the areas in a a good amount of time safely. So to answer that question specifically, I definitely would want to consult.
We've got a couple questions here about filler in the skin, and specifically one is referring to Juvederm. Juvederm is a hyaluronic acid filler, which is all of the fillers that we currently use when talking about dermal fillers or skin fillers. The question is, what if you already have filler? Will Profound affect that filler?
If anything, it'll make it better. I mean, it's not going to dissolve it. It's not going to do anything to it. It's perfectly fine. Now, I would say we want to wait until the hyaluronic acid from the dermal filler has integrated into the tissue before you do Profound. So I would say if you've recently had filler treatment, you want to wait at least a month before doing Profound.
There's a question specifically about the difference between CoolSculpting and Profound, and I can answer this. CoolSculpting is a treatment where we reduce the temperature of the skin and fat, and the skin is fine, but the fat goes into a programmed cell death or loss permanently. So it's gone, and we're really reducing the fat under the skin. We celebrate skin tightening when we do CoolSculpting, but it's not a specific outcome that has been measured, and nor is it one that can be expected. Profound, on the other hand, is heating up the skin, specifically the deep layers of the dermis, to cause contraction, tightening, shrinkage of the skin itself by producing high-quality collagen, elastin, and hyaluronic acid. We have a question here. If you add on eyes to the lower face and neck, what is the cost for that, since it's a small area?
I think that is another one. If there are anything to do, any more questions to do with add-on areas, definitely we'd love to see you in for a consult so we can assess the area and give you a really great option.
We have a question about... Thank you, Allison. We have a question about, can you have Profound treatment with a profractional laser treatment under the eyes at the same time? And the answer is yes. A lot of the laser work that I've been doing on many of our patients who are having resurfacing is a combination of profractional for deep tightening of the skin in the mid-face, the eyelids, lower and upper eyelids, and the forehead area, as well as contour TRL, which is a micro laser peel, essentially removing the very outer layers of the entire skin surface. And then also simultaneously treating with Profound for the lower face and neck areas. And this we call the trilogy, and this is something that's been very, very common in our practice, very popular, because it's one downtime and we're treating a bunch of different things at the same time. We're able to tighten the skin of the lower face and neck, resurface the entire skin so that the skin has that radiant, light reflective glow, and then kind of give the gift that keeps on giving, which is profractional, which is a deep resurfacing that allows your skin to tighten over the next 6 to 12 months. And so it's one of our most favorite treatments to perform. And we do this in the office. And in these situations, to make our patients have the best possible experience, we provide IV sedation with our board certified anesthesiologist, Dr. Melissa Cady. And so she's able to make you very comfortable for the treatment. And before you know it, it's like having a quick nap, and then you're on your way home. Do need a driver for those days.
Yes.
We have a question about the beginnings of a turkey waddle. And this is good timing as Thanksgiving's right around the corner.
Yeah.
Will Profound help that?
Absolutely. Definitely. This is what Profound is for in the lower face and neck, is to treat laxity.
We have a question about the effectiveness of Profound versus Kybella on the under chin, pooch, or double chin area. I'll let you answer that, Allison.
I love this question. That's such a great question. So Profound and Kybella work very differently. So Kybella is an injectable that works on dissolving fat. Profound is going to dissolve fat, but it's also going to tighten the area. I definitely recommend coming in for a consultation so we can look at your skin and look at whether we best feel like Hybella or Profound would be the best for you and give you the best benefits.
We have a question about whether or not Profound can be added on during surgery. And the answer to that is yes, Profound can be added on when having other procedures. Predominantly, I perform breast and body contouring procedures. And I've had experience doing lower face and neck Profound at the time of surgery while you're already under anesthesia at our private surgical facility called Stonegate. Also treating skin laxity in areas like the outer thighs. Without an incision, needed to remove that skin or placing a scar there. So we're doing a little liposuction to reduce or debulk the soft tissue under the skin, and then using Profound directly in the skin in order to tighten the areas of the outer thighs or inner thighs. It's also a great area to use for patients that aren't great candidates for liposuction of the inner thighs, and it can be used to help really debulk by using the subcutaneous application of the device, and then using immediately following that with the dermal application. So we get dissolving, permanent dissolution of the fat that's there, but also skin tightening simultaneously. It's an amazing way to tighten the fronts of the knees. So the area that's just above the knee into kind of the lower third of the thigh, of the fronts of the thigh. And we're seeing incredible results with that area. And then, of course, as you heard from the testimonial in the video, the underarm area, the area that's between the elbow and the axilla or armpit area, the area that's been referred to as bat wings or my mom's arms or my grandmother's arms. It's a phenomenal way to debulk the soft tissue, the fat that's there under the skin, and then to immediately tighten the skin. And probably is one of my most favorite areas that we treat, because I think it's the alternative to that is to essentially place an incision there to remove the skin and fat directly. So I think it's a phenomenal area to treat. We've got a question about how long after treatment should you wait before getting Botox in the same area?
I would say wait till you're completely healed. Everyone heals a little bit differently from this, but I would say wait at least 10 days.
It's important to understand that Botox is being placed directly into the muscle itself and not into the skin or the fat. So it's a very different area, but we want to make sure that this swelling is decreased and that when we treat with that area with neurotoxin, Botox or Dysport. All right. Allison, do you have anything else you want to add today?
I don't. I'm so excited. And this was so fun doing this with you, Dr. Piazza, and our patients. We couldn't do this without y'all. And we love y'all to death. It's just an amazing thing that we've created. And it takes you guys, not just us, to create that.
Well, we want to thank you very much for attending today. This is a technology that we onboarded in Q1 of this year and have been really perfecting our treatment with this and creating an amazing experience for you. We have one question we'll answer real quick, which is about the cost of the arm area, the double treatment of skin as well as adipose tissue or subcutaneous fat. Do you have that, Allison?
Absolutely. So that would be considered, if we do one area, and like I said, we have to measure what the area is, but if we were going to look at it as just one area, it would be the 5,000 to treat the cellulite in the arms. And then you would take 500 off of that. So it'd be 4,500. And then your add-on price for the skin tightening of 1,500.
Excellent question. We also have one other question about open on Saturdays, and we're currently not open on Saturdays, but it's something we're looking to do in the near future. Thank you for requesting that. I know that our providers are always looking to accommodate our patients by staying later or coming in earlier to be able to accommodate their schedules. Just so you know, you will be getting a text. Please reply yes, and we will be so happy to see you for consultation. We really thank you very, very much for attending this virtual event, and we look forward to seeing you very soon. So thank you very, very much.
Thank y'all so much. Have a great night.
Have a wonderful evening.